My name is Tyler. I'm a senior here at Hofstra University, and I'm a health science major. I chose Hofstra because they were the only university that showed a very strong interest in me as an individual. I came on my visit and I fell in love with the campus. I fell in love with the proximity to New York City. I fell in love with how close it was to the beach. At Hofstra Rotaract, we do a lot of community service. It's a community service-based club. We work very closely with the Babylon Rotary and Rotary International, which is an organization that works on the eradication of polio worldwide. So we do a lot of fundraisers. We help out in any way that we can. We actually, last semester, we threw a caregivers ball, which we raised $1,600 to go to Rotacare, which is an organization that provides health care to individuals who are uninsured in the local area. So that provided a couple months supply of insulin for a couple people, which is awesome, which I love to do. You know, I love to help out in any way that I can. And I was actually fortunate enough to become vice president of Hofstra Rotaract, and I just plan on doing fundraising just as much as we have been doing. APHOS stands for Association of Pre-Health Studies, which is one of the clubs I got involved with my sophomore year. I knew that I wanted to go to medical school, so I needed to have the resources to know what to do next. So it gave you the opportunity to know what prerequisite classes you needed, what was the tuition for medical school, what MCAT was coming up, the change in the MCAT, because the MCAT has changed, what you should do to prep for it. Volunteers Around the World is a great organization that just came to light for me this year, in my senior year. They do medical outreach programs to different parts of the world, basically. So this winter, we're actually doing a medical outreach program to Panama, and through Hofstra Rotaract and me being president of Edison Gamma, we were able to have a fundraiser for the medication that we will be taking on. So the fundraiser is coming up, but we plan on raising about $1,000 in medication that will be purchased in Panama and used by the doctors there. So we're able to keep our free clinics open longer, we're able to treat more people, and it's just an overall great experience that I'm very looking forward to when I attend the trip. My internship is at Pediatric Associates of Plainview, and I do a lot of things that people don't really understand when it comes to a private practice. I learned how to do insurance billing, learning the ICD-10 codes, which just came out. I learned scheduling, when to schedule people, when not to. And then I do a lot of shadowing too. I look after the doctors, we look at diagnoses. At the health science department, I feel like all the teachers are there to help students prepare for after graduation. As I take more and more courses, it really has honed my skills into what I want to do. So this semester I actually am taking Perspectives on Healthcare Reform with Dr. Cofield, and I love that class so much, and that's why I want to get into health policy and government and politics along those lines. But I've also taken classes about chronic and communicable diseases where I met Dr. Caden, and she's the pediatrician that I follow at my internship. So it's allowed me to gain connections with superiors, which is really important. You need to network yourself, and I'm glad that the health science department has allowed me to do so and further my education that way. After I graduate, I plan on taking a gap year before I start applying to medical school. So I'll be taking my MCAT this summer and getting all my letters of rec in line and all that kind of stuff. And I'll be applying to a research program at Lehigh Valley Hospital back in Pennsylvania to work in research there. But I also would love to work for the government too. I'd want to work for the Department of Health or the CDC, and that's kind of the end goal. So once I'm applying to a very specific degree, I want to get my MD, MPH, so I'll become a doctor with a master's in public health, so I can work in preventative medicine and work along the lines of epidemiology and figure out, try to help cancer rates and diabetes and obesity, which are public health related issues. I would love to see those decrease over time. So I want to be part of the bigger picture, and that's exactly what I want to do.